All right, thank you for staying with us. And to begin our conversation on drug awareness and rehabilitation bill, let's take this background report. Oh, no background report. Okay, let's begin the conversation here by introducing in the studio Chuks Akamado, who is president, Center for Ethical Rebirth Among Nigerian Youths, Serani. He's also a barrister at law. A pleasure to welcome you to Good Morning Nigeria.
Thank you so very much. Good morning, Nigerians.
We also have here in the studio Dr. Hope Omeza, VGADA, MD at VGADA Specialist Rehabilitation Centers. Thank you for joining us.
It's my pleasure. Thank you.
All right, we have all gentlemen for this conversation this morning, and still with us right here in the studio, Dr. Muftar Mohammed. He's a senior lecturer and consultant psychiatrist at the University of Abuja Teaching Hospital, Gwagwalada, Abuja. Many thanks for joining us, Doctor.
Thank you for having me. Thank you.
All right, and joining us from our Kano studio, we have the sponsor of the bill, Senator Rufai Hanga. He's a Deputy Senate Minority Whip and Senator representing Kano Central. Many thanks for joining us, Senator Rufai.
Thank you. Good morning, Nigeria.
From Kano, I think it's fair to ask why this bill has become so relevant at this time. And by the way, what's in it?
So the bill, the drug awareness and rehabilitation bill. The bill.
I'm not sure. We have to deal with the audio from Kano just so that we can get clear contributions from the senator. So let's get back here in the studio. In the meantime, I don't know if Chuks Akamado has seen the contents of the bill and what you make of such a bill at this time.
Well, I have not had the privilege of reading through the bill, but the general principles of the bill are what we have out there. And for me, it's a welcome development. For me, it's a step in the right direction. For me, it's going to strengthen our fight against strengthen the fight against drug abuse. It's also going to effectively complement the commendable effort of the NDLA. So with the establishment of an institute for drug awareness and rehabilitation, we're going to enter another phase in this particular fight to redeem our society from the vice grip of drug abuse and illicit trafficking.
All right, many thanks, Dr. Kamadu. Oh, did I say Dr. Kamadu?
He's a lawyer.
Okay. Thank you so much, Barrister. Let's get to Dr. Hope Omaiza now, MD for Agada Specialist Rehabilitation Center. I would like us to look at the content of this bill. If you have had the opportunity to look at it, I would like you to tell us what it entails. I just hope the connection with Kano gets better. But you see, listening, to the content of this bill when it was being presented at the Red Chamber earlier this month, there were strong oppositions as to why this bill should not scale through. I'll simply just quote some of the senators on the floor of the Senate chamber. Adams Oshomole, representing Edo North, kicked against it, saying, with the way bills are flying, very soon we'll soon have a bill against cough. And he said, it's just about strengthening what other agencies that are already existing are doing instead of creating another institute. The senator representing Jigawa West, Senator Babagida Hussaini, also kicked against it, saying that it's just a mere duplication. I mean, the NDLA is on ground, and we see what it's doing. It's about strengthening, what NDLA can do and of course some other agencies. I'd like to hear your view. First and foremost, what do you think about this bill and these other disagreements about the bill?
Yeah, thank you very much for having me in your studio. Well, there are many dynamics to this bill in contest. This is because there are different opinions and views. For example, we have the Agency for Drug Law Enforcement, which is the NDLA. I also know that NAFDAC also contributes in drug control in Nigeria. There's also a Department for Drug Demand Reduction in the Federal Ministry of Health. We have the National Rehabilitation Agency also that have work to do. And over the years, we've seen all of these agencies cry for lack of funding. As a matter of fact, maybe if you ask NDLA, for example, they might tell you some of our activities are being sponsored by international organizations. And I've been in your studio severally, and we have mentioned that the NDLA, as it is, are short-staffed, despite the recruitment year in, year out. However, argument will also be that, do we strengthen the existing agencies? Do we look into their areas of budgeting and fund them to do their work? Or do we completely separate this job and attach it to an institute as the bill is proposing? Now, if that happens, some are arguing too that this will be better because the NDLA, being a law enforcement agent, or agency rather, seem to be militarized in their formation. This is not to say that there is not a Department for Drug Demand Reduction in NDLA that carries out activities revolving around awareness, sensitization, even trainings for NGOs. I partner with NDLA and we work together in many fronts. However, the psychology of the people we are dealing with, especially when you talk about the issue of stigma on those who suffer drug addiction, and you are now having to engage these civilians with people who are perceived to be militarized and arrest people who traffic drugs. NDLA over time has evolved to not just arrest everybody, but they have been able to separate between those who traffic and those who use. And so it's been implemented that when you have those who are users, you treat them, send them in for counseling. So I've mentioned here that I've got calls on the roads to Kano by NDLA staff referring people they caught with their parents to my facility for consultation, for assessment, and for counseling. They were not arrested. They were only asked to write statements and then, of course, make contact with us so that when they get back to Abuja, they can have some reviews done. Now, that is a step in the right direction for the agency. But how many of the citizens of Nigeria are aware that NDLA has the positions to carry out awareness program, not just to arrest them? So whenever they see NDLA coming, the mentality is they are here to arrest us. So that may be the strong opinion of those who are proponents of this bill. That you see, you know what? The psychology of human beings are important in dealing with this case too. Let's not engage agencies that are being perceived by the citizens as militaries. Arrest, which is what most of the times you see the NDLA news or the NDLA the narco news. All you see is the arrest. I have made several suggestions for the NDLA as well. Why not let's have programs that also show what you are doing in drug demand reduction so that people know that when they see you, you are for them. But when the suppliers see you, they know that you are against them. So, but that may be the problem that this bill may want to solve. But again, the issue of funding may be another problem, because setting up a new agency or an institute and then doing all that needs to be done may be a whole lot for us to do. So I know that in public policy, you have to look at other alternatives, which is why I'm saying that we need to consider all the areas. Do we go for this bill and enact an establishment for an institute for drug awareness and treatment, which is good? Are there other things that can be done as an alternative? Because public policies are meant for public interest. So, and most times there could be other individual interests behind public policies. I mean, I'm a student of public administration, apart from being a medical doctor. So I understand that, I understand the different, emotions behind the bills and why, like you said, it was a big controversy in the Senate, in the red chambers, why this bill was being read. So I think we need to put this in perspective. Okay, are there better things? Are there alternatives which can include reinforcing the existing structure, reinforcing the status quo, or changing to a new establishment that can better deliver on the job? So
Well,
I think
I think that's a question the senator will probably provide answer to now that I understand that Kano is ready and we can get across to Senator Rufai Anga. Senator, you've had the privilege of at least listening to two of our guests here in the studio, but again, the criticism is that while NDLEA is not funded well enough, we are going to set up another agency. Is there anything that the new agency will do differently from what the NDLEA is doing, or are we going to carve out part of the responsibilities of the NDLEA for this, just to have a targeted approach to dealing with drug abuse?
There are many things that what we are seeking to establish will do much more than all those you mentioned. For example, NDIA, I was the chairman of the Drugs, Narcotics, and Financial Crimes of the Senate. I joined the few Senate, and I know the law thoroughly. They don't have the mandate to do what we are seeking to establish now. And this is what we are seeking for this rehabilitation is not for psychiatric hospitals, and nor is it with NAVDAC. We have a doctor with us now. Now, what we are seeking to establish is a specialized way of rehabilitating this kind of illicit drugs abused. We have had only one in this country established by Senator Rabi Musa Honkoso when he was a governor in Kano. Only one, and that requires specialists, a doctor, a psychologist, and a social welfare worker. These are the specialists who will put there to make sure they are rehabilitating people well. When NDLEA arrests people, what they do, they interrogate them, maybe lock them up, and at times prosecute them. By the time they are released, maybe they think they are sober. Certainly, they might be sober, but they go back to their, even if they went to jail for some time, they will go back to their bad habit. But with this kind of rehabilitation we want, it's a rehabilitation that when somebody comes out, he will be ashamed to even associate himself with this kind of bad habit. I think, like the doctor actually said now, I've heard him, he said at times NDLA consult him to see some people and assist them. Now, there is need for a doctor, there's need for a psychologist, there's need for a social welfare worker to do this kind of specialist job. The only place I saw this kind of thing, and I'm sure the doctor will witness me, give me a witness, is UK, with this kind of rehabilitation centers. What they do is when somebody is abused, they move off the streets with this kind of addicts. They take them to a special rehabilitation center. They put them there, rehabilitate them, or reorientate them, and then throw them to society. And in 99% out of the 100 cases we've seen, we took, they never go back to the habit. But in Nigeria now, the only authority we have dealing with that is NDLEA. And there are certainly a lot of lapses. And it was like one of us now suggested that we can expand the function of one organization to take care of that. What is the difference? when you expand the function of, let's say, NDLA, you need to establish a whole department. And the whole department will have to provide for all those professionals talked about, and plus other ancillary staff that is also like a professional to the field. What is the difference? And like the doctor rightly said, you see, if you establish this, psychologically, it will give a difference to all what is happening. And I'm sure that will help a lot, because all we know that psychology plays a lot of part on many other, everything in our lives. So establishing that is different altogether from all those. And in fact, when I brought the matter to the Senate, a lot of people argued that we have NDLA. Some say we have psychiatric hospitals. But then I explained, and a lot of them understood, reasoned with me, and that's why the bill scales a second reading. What I've said is just a brief of the bill. If you go through the bill, you will see so many things that will certainly convince somebody that, yes, we need this in Nigeria. Because we are in 2024 now. We're in digital age now. You see, we're always improving. Technology and things are always evolving everywhere. So I think there's need for change. Change is to give an approach to a better way for taking care of our drug addicts and all these abused people. Now, my lamentation is, like I said, Kano is a religious society. Kano is the most populous state in this country. We have the most road littered with all these kind of drugs in Nigeria, I think. We have a lot of out-of-school people. Some are graduates. Out of frustration, they go into drugs and so on and so forth. So there is need to make this effort to establish this awareness centers and rehabilitation centers. We will move them off the street. What we have to do is that no matter how much we spend, it's our responsibility to take care of our people. It is our responsibility to take care of our citizens. We can't just let them die on the street simply because we don't want to spend money. We have so many organizations that have a very similar function, and they always interact in functions that are useless. Let us trim them. We have a lot of them. We still said that there should be a trimming of all these organizations that are useless. They always spend money on them. But this is very useful. We need our people. You need our health. We need a healthy society. We need a very sane society. That is my conception.
Senator Rufai, for your opening comments, we do sincerely appreciate you, and thank God that the audio is better. But to make sense of some of your comments, you talked about if a department is created in NDLA, it's not different from an institute. Well, at this point where we're cutting the cost of governance, of course, there's a whole difference between a department and an agency entirely, to deal with this particular issue. And with the NDLA, talking about previous engagements, like Dr. Omaiza tried to mention, the NDLA, tries to sensitize people. It has an awareness department. I know there's a jingle running on NTA, for example, that, creates that awareness about drugs. And then in terms of rehabilitation, like Dr. Omaiza is trying to say, the treatment for those who use drugs and those who trade in drugs by the NDLA is completely different, from, what, staff and officials of that agency have mentioned. But, I'll pause you and get back to you, on some of the comments that you have made, so that you can make some clarification. But let's get to Dr. Mufta Muhammad, who is a consultant psychiatrist. I want to find out, before, just look away from this bill, what do we have at the moment in terms of rehabilitation of drug users? What is existing? What is your experience as someone in this field in the country? Is there something lacking that needs an agency?
Well, thank you very much. We do know that mental health conditions generally, including substance use disorders, are common. the World Health Organization estimates that 1 in every 4 people is at risk of having a mental health condition in their lifetime. But one striking thing is that over 80% of those who need mental health care are not having access to evidence-based care, medications and psychosocial interventions. So, but it's important to understand that
Mental health and drug
disorders,
use are two different things. You could have a mental health condition, not because you use drugs. Now we're talking about drug use and rehabilitation here.
yeah, they are closely linked. Maybe we'll discuss that further. But I do want to reiterate that substance use disorders are a critical part of the mental health conditions when we are talking about mental health generally. So substance use disorders are also part of it. Substance use problems can lead to mental health conditions, and mental health conditions can also, in a way, lead people to begin to use substances. Maybe we'll discuss that further. The treatment of people with mental health conditions, actually, with substance use conditions specifically, involves trying to detoxify them, get them to get rid of all of the substances they've taken, for example. That's detoxification, when and address any psychotic symptoms, for example, they may have acutely if they've developed problems. But there's long-term care, where they would have to be rehabilitated, engaged in some form of psychological therapy to get them motivated to abstain eventually from using these substances. And we have the psychiatric hospitals in the hospital. The federal neuropsychiatric hospitals also provide that kind of support within the hospital environment. Also, the psychiatric departments of teaching hospitals and other federal and state departments of those hospitals. So, but the treatment of these conditions is actually much wider than that. We should also think about promotion of awareness, but also prevention of substance use. We do know that a wide range of factors can lead people to begin to use substances. These are social determinants of mental health and substance abuse, including insecurity, stress-related problems within workplace, and other problems, that people experience that can lead them to begin to use substances as a way to cope with these difficulties. So yes, there are centers within federal neuropsychiatric hospitals and other state departments of mental health in other state general hospitals. But there is a need for more elaborate support, that cuts across prevention and promotion but it's also multi-sectoral. You have to address this from other sectors to ensure we reduce poverty, we empower people, and then that can really help in...
Listening to you, Dr. Mohammed, just some weeks ago we had a topic here where we talked about mental health. Although we agree that, yes, the use of substance, of course, would lead to mental health. But, there are, like you also mentioned, there are so many other factors that would contribute or, make someone, have a mental health condition. Substance use, yes, but not like a main factor for Nigeria at this point in time, looking at, economic realities and, so many other pressures the Nigerians are facing. But I'd like to get to you, Dr. Meza. You wanted to respond to what the senator said, so let us know, what are the gaps really that you think that this agency will fill, or you think that other agencies cannot fill at the moment?
Okay, so I listened carefully to the senator, and I see, this bill coming from a point of passion and a point of individual interest. What I mean by that is because he mentioned Kano, which is about the hotbed of drug use in Nigeria. Even though the last research in 2017 put it for Lagos being the highest, the state with the highest number of drug users. But so you can see that the experience of the senator in Kano is the reason why. Of course, I'm not saying that it's not affecting that part of Nigeria. It's perhaps the major reason, why this bill is such a dear thing to him. Now, which affects every family in Nigeria. That's the truth. Now, he mentioned that forming a new department is synonymous to having a new institute, which you have tried to, palliate. But you see, the thing is this: the NDLA have department already, which is called the drug demand reduction, and they also have the drug supply reduction. They have directorate for this already. The drug supply department is where they engage with drug peddlers. The drug demand reduction has a director where they engage with people for treatment and prevention at different levels. So you see NDLA going out for awareness, sensitization. For example, in Gudu, the FCT command have a rehabilitation center. And I know that, was it in 2019 or 2020 now, the government was going to cite 6 rehab centers, 1 in each geopolitical zone, under the auspice of the NDLA. And I'm aware that about 2 have started foundation, and I don't know where it has gotten to, but they're actually having that. And in most of the commands, they have, some facility to keep individuals who are users, not prosecuting them. Yeah, so that's on one side. Again, the NDLA have organizations, NGOs, including myself, registered with them that assist in carrying out all these advocacies. Every Fridays, the NDLA engage Nigerians in social media via their Twitter platform, their X platform, on discussing issues. They host experts. The NDLA have psychologists. 2 years ago, NDLA, under the leadership of Marwa, launched a toll-free call helpline. And many people have benefited. All of these things are tools they have implemented to assist them in carrying out drug awareness, drug prevention. However, have also cried severally that, you see, a lot needs to be done in drug demand reduction. Because if there is demand for a product, businessmen will certainly go at any length to get their products to their customers. So if you do not, first of all, reduce the demand, the supply will be there. Because if you arrest me today as a supplier, I would find another way, another means to get it to my customers. Unfortunately, the customers in questions are our people, our young people, the future and the present of Nigeria. Now, these people who are hooked on substance cannot control that behavior. You see, my very senior lecturer here have mentioned to you that addiction, drug addiction, is a mental illness. I keep saying this. Unfortunately, because of the stigma around mental illness, people try to separate drug addiction from mental illness. It's a subset in mental illness. In fact, you can't diagnose addiction without looking at the protocols in the mental workbooks and all, the DSMs and the rest. So it's a mental illness, and it's not only is it a subset in the mental health component, it is also linked with each other. There are individuals who suffer depression, or who suffer bullying, who suffer some form of anxiety disorders, and their colleagues tell them in school, take this particular substance, you feel okay. You see the link now. There are also people who, because of the use of these substances, they have psychotic illnesses, mental illnesses, and then some don't even have. Okay. Now let me quickly broadly define mental illness into 2. We have psychotic mental illness and non-psychotic, which is the neurotic mental illnesses. Now, so there are times where individuals suffer both forms of mental illness, whether neurotic or psychotic. And so the State also mentioned the treatment modality in Nigeria, and he said he has seen the type he's proposing in UK. It's not completely true. For example, I have 2 rehab centers in Abuja. I know a couple of others with rehab centers in Abuja, and this is the modality. We have consultant psychiatrists, we have medical doctors, we have mental health nurses, we have clinical psychologists, we have certified counselors, other social workers. And these people, unfortunately, sometimes the media had painted pictures of rehab centers in the past where you see people being punished, people being tied down under a tree, flies perching on them, and a whole lot of that. But in our centers, for example, our patients sleep under air conditioner. So, and there are many other rehab centers in Abuja. And of course, the practice is international standard. We have NODC training and even intervening in some of the things that rehab centers do. So what the minister is proposing is obtainable in Nigeria, perhaps not at not at the level of the government, perhaps. So, but like I said earlier, the bill is coming from a point of interest, which is not just the senator's interest, but it is actually a national interest. But we need to also look at opportunity costs. Again, that's speaking as a student of business administration. Okay, now as opportunity cost, where are there other things like insecurity, poverty, that my senior colleague here had mentioned, that it is multi-sectoral. People need to be empowered. That's not to mean that lack of employment is the cause of drug abuse. It's a risk factor. There are people who are employed, who are busy, and they are taking to drugs because of their busy schedules to stay awake and be active. There are people who, in fact, governors of states who are probably using drugs. Would you say they are not employed? They are overemployed, if you ask me. But then they are taking drugs. It's not because of poverty too. That's the risk factor. There are people who are very rich, and that's the reason why they are able to even afford these drugs.
But would you say that, in spite of all of this, that the efforts of the NDLEA, in collaboration, of course, with NGOs like yours, would you say that the efforts are nearly enough given where we are as a nation in these drug matters, not to warrant carving out an agency to give it the attention it deserves?
Thank you very much. You see, it is not even close to enough, the effort. And I had mentioned earlier one of the reasons why it's not close to enough. There's also room for public policy analysis, which includes evaluating what you have put in place and seeing where the lapses are. Now, does it warrant carving out a new institute or an agency, or do we need to do something right with what we have already instituted? That's the argument. That's what the argument should be about. So
That's what it is.
It's to call the NDLA to the table and say, you know what? Drug demand reduction, you have a directorate already. What are people doing here? We see the rise of drug users despite the publication of drug seizures. So what's happening? What can we do? I've several times mentioned to the chairman that we need to intensify efforts on drug demand reduction. But the truth is this: do they have the capacity? Now, why is there no capacity? It comes down to fund. So if you set up a new agency or an institute,
How do you
it will
fund
still
it?
come down to fund. It has to be funded.
Thank you, Dr. Maiza. Let's pause you here and get back to Senator Rufai now. Listening to Dr. Maiza speak, it shows that dealing with drug users is like dealing with the symptoms of a disease. There are factors, that propels, that propel people, to go into drug use. And, Dr. Maiza said it's an individual, based on what you see in Kano, being one of the states with high number of drug users. In your own perspective, do you think that it would be better to deal with some of the causes, of this symptom, that's drug use, talking about employment, talking about getting the youth engaged and all of that, so many other factors really that need to be put in place, functional environment for people to thrive and survive. Is that a better way out of this? Is that a better channel of funds than having to deal with rehabilitation? Because like you said, you could still rehabilitate those people and they go back and still go back to the drugs. So would it not be an effort in futility trying to deal with the symptom and not the disease? Senator Rufai, did you get my question, sir?
I do. Yes, I do. In answering your question, maybe I may have to ask some questions too, and of course make a request. One, you see, why we thought it is better to have a separate establishment altogether from psychiatric hospital, NDLA is one. Like the doctor mentioned, as I understand, the doctor is a consultant to NDLA. They consult him on certain things. is it better to have a consultant rather than a permanent person, administrating the place, If the doctor is not only a consultant to LDLA, giving them advice from time to time, assisting from time to time, it's no better if he has a place to be permanently there, oversee it, and make sure things happen. That is one. Number two, what I said, if you go through the bill, you will see there's a lot of psychological factors there. There is a question of stigma. I said it. Psychological part is when somebody is taken to psychiatric hospital and undergoes rehabilitation there, when he comes out of there, people see him still as a madman. In our society, I don't know in other climes, but they see him as a madman. If he does something, even if it's right, people will laugh and say, yeah, the madman is still there. That is one. But if it is, NDLA, which I know they don't have, I don't know now, but yes, I knew them, they don't have proper rehabilitation center where there are professionals like a psychiatric, like a psychologist, like a doctor, like all this kind of thing that will assist people recover. Now, you don't used to have it, but maybe they have now, like the doctor said. But the difference is, once you're out of that facility, you are always seen as a criminal. That criminality in the thing is there. But once you are taken to this special rehabilitation center where they detoxicate you from the drugs, orientate you, put reasons into you, put sense into you, psychologically clean your mind, I think it's better. That is what we thought. And the amount to be spent on establishing a department under any organization, doctor might think, may be similar to the amount that will be spent on establishing this. Because even now that they have this quasi department for doing that, because I call it quasi because it is not proper, like he said, nothing close to what is needed. He said it himself. They are spending money on consultants, they are spending money on certain things, and they are not serving the purpose. Because no matter what they spend on consultants and whatever to rehabilitate somebody, the moment he goes out of there, he's a criminal. And if it's taken to psychiatric hospital, the moment he comes out of there, he's a madman. But this one, people see it as different. That's psychology. Psychology is important. And I'm sure the doctor knows better than me, the psychiatric doctor there knows better than me what psychology plays in people's life. So that is why there's a lot of things. I think if I know the doctor's address, I wouldn't mind taking a copy of the detailed bill to him to study, and then maybe he will have reason to maybe understand. Better for him to head the place and to be a consultant to one organization that deals with that. And I'm sure the money they pay him as a consultant must be more than the money they will be paying the managing director or the chief medical director, whatever it is called. So all these kind of
Senator Rufai, I apologize for interrupting you, but you see, my main question is having to do with the drivers. Why people go into drug use. Because if people don't use drugs, there will be no need to rehabilitate them. All right. So I'm saying that if you do an analysis of those who use drugs, there are factors at the moment, especially in places like Kano or Lagos, that push these people to use drugs. Instead of focusing, energy, attention, and resources on rehabilitation, why don't we focus as a nation on dealing with some of these factors, these drivers? Because like Dr. Obaisa said, the demand is high. So if demand is low, of course, So why are you not thinking about that? How to reduce, the push or the drivers for drug use instead of having to deal with the after effect of drug use?
You're right, but I think we have NAFDAC to take care of part of what you are talking. We have the NDLA to take care of that. In case where this fail, in case where these two fail, that is why we have some remnants of those who go into drug and other illicit substance taking out of frustration, out of ignorance, out of idleness, out of many factors. So that organization and that authority will take care of that. But certainly what you are talking about, we have NAFDAC to take care of part of it. We have NDLA to take care of part of it. And we have even psychiatric hospital to take part of that. But this one is where we don't have 100% success in carving out the drug abuse, the drug use, and kind of thing. Then you have this to take care of the remaining persons that are affected.
Very much for your contributions so far. Let's get back here in the studio with Chuksa Kamado. The senator is saying, look, where we are, we have a lot of cases already, and we need to do something to deal with it. He's talking rehabilitation of the number that we already have, a dedicated agency to deal with it. Well, some others say there are things that push people into drugs. I think these are two different things. We already have a large number in it that need to be dealt with. Now, but we have people who are also aspiring to get into it. So what needs to be done apart from the bill or in spite of the bill to ensure that we don't have the numbers going into drug use and then needing rehabilitation?
Thank you very much. Well, I think we shouldn't model this up. If you want to discuss the causative factors, it's an entirely different ball game. And I can assure you it will be an endless debate. The people will accuse the government will accuse the people, it will go on and on. I think we should stay on the merits of this bill. If we go into the causative factors, I can assure you we won't rise. We will not achieve anything meaningful. But that aside, I would want us to nuance this conversation so that we can have the bill properly contextualized. Now, I understand the sentiments of the average Nigerian because I live here, that ours is a struggling economy. Yes, we have competing interests. We have infrastructural gap, we have gaps in education, we have gaps in agriculture, we have gap in every sector of our economy. And then people are now saying, and quite rightly, why should we have an agency? It's a legitimate question. From a concerned Nigerian, a patriotic Nigerian should worry. Why should we spend more money since our funds are limited? I understand that. But the question is, and that is where some of us come from, do we also realize there is need for us to prioritize as a people? If we have to prioritize, then we must come to a point that we recognize drug abuse as a national emergency. Drug abuse in this country should not be treated with levity. It should be on the first line charge. That's what we have failed to realize. Drug abuse should be treated. When President Buhari was here, I think, no, it wasn't President Buhari. It was the man that Buba Marwa replaced in office as the NDA legend. He said, drug abuse fuels insecurity in this country. Do we appreciate the role drug abuse plays in the security of this country as we speak? If we also understand that drug abuse is fast destroying our youth population, it's not something we sit down or we stand up and begin to discuss as if it's about setting up an amusement park. It's not about setting up an amusement park. This is not frivolity. This thing is a very serious business because what's at stake is the future of this nation. What's at stake is the future of our children. Those of us who are on the streets interfacing with these children, we know what we see every day. Our young people, secondary school students, primary school pupils, they are far gone. We are truly in dire straits as regards drug abuse in this country. So for me, it's a national emergency that should be prioritized. Then if it should be prioritized, and we agree that there is need for us to prioritize on it, then the question becomes, should we fortify
The NDLEA.
the NDLEA so that the NDLEA, in view of the current state of our finances, very valid argument. And I can assure you that today, NDLEA's Drug Demand Reduction Department is doing well. I have actually benefited from that department because that department has trained me in drug prevention, treatment, and care. So nobody argues that at all. But the issue now is, I have also,
Is it doing enough, though?
good.
It's done well.
Yes,
Is it doing enough, given
that's
where we
where I'm
are?
coming to, sir. That's where I'm coming to, sir. Now, my NGO has done collaborations with NDLEA in the past where we visited schools from one secondary school to another and all of that. And I can assure you, I'm speaking from a position of knowledge and experience. You see, the fact that NDLEA is a paramilitary organization is a limitation. They wear uniforms, they bear arms. These children, unless we don't have our eyes on concrete achievements, unless we don't have our eyes on outcomes that would impact the society, unless we are interested in the optics and the aesthetics alone, if we are really interested in rolling back, in stemming the tide, and of course containing this whole drug abuse thing, then we should have our eyes on outcomes. We should have our eyes on feedback. It's one thing for an NDLEA staffer to approach people and talk to people. They can talk to people, they can even talk at people, but have they spoken, have they talked with the people? Effective communication is when you get feedback. Effective communication is not when you go out there, you say you do awareness campaign and you push things out there and you leave it at that. No, it won't give you the desired result. That's what I'm saying, unless we're being cosmetic about it. I think we need a different body that does not bear the badge of a paramilitary organization, so that the people, yes, and we need a body that does not bear arms, so that the people can let you into their world. These are young people we are talking about. Their perception, the way they perceive NDLEA is that, oh, these people would throw us into jail. Oh, is it not these people? In fact, when they, they cannot separate drug consumption from drug trafficking. They don't understand that the NDLEA has empathy for those who are involved in drug use and would want to rehabilitate them. What they have in mind is that NDLEA will want to throw them into jail. And that's what we're saying. It's for this reason that I'm saying that NDLEA, for this reason, is hardly suitable for this particular role.
But would you then say,
Yes.
that
Yes.
the NDLEA department in charge of this kind of role
Yes.
be pulled out to this new agency? Because if you don't do that, it amounts to duplication.
No, of course, if they are setting up an institute for drug awareness and rehabilitation, they have to wind up that department, and they have to go to NAFDAC too and see another similar department that NAFDAC
As foundation.
I'm glad that you have mentioned that.
so that they can merge them, so that they can come out stronger and do this job very well. Why I'm saying this, please? We need an agency, we need an institute, we need an organization, a government institution that can directly interface with the communities, directly with the wide range of stakeholders we have in the drug abuse war and illicit trafficking. No, when you talk about illicit trafficking, then you leave that for NDLEA. See, this thing, I don't know why we are looking at it like this. This thing would help NDLEA. If you watch NDLEA very well, they're overwhelmed every day. Can't you see the statistics? Look at the statistics every day. They arrest here and there all over the place. The trafficking in this country, Nigeria is no longer a transit country. They consume, they do here, they import here.
But some say they are overwhelmed because they are not well funded.
That is what I'm saying. It will enable them. They should be funded better. Yes, I'm for those who say they should be funded better. And they deserve better funding. But if they focus on drug supply, drug supply reduction, you will find that their efforts will be a lot more felt by the people of Nigeria. And this this institute that we are talking about, if it's properly constituted and well staffed with people with the requested competencies, you'll find that they will be complementary and for the benefit of the country.
Talking about this institute, Barrister Akamadu, where would you want to cite this institute, for example? this country has 36 states. So, I mean, this drug use is everywhere. So you're not going to focus in one particular region, for example. So you have to deal with the whole country. That's one. You mentioned NAFDAC. NAFDAC has an agency that deals with drug awareness and all of that. NDLEA is there. Of course, maybe in terms of awareness and sensitization, we should bring in the National Orientation Agency into all of this. So if the NDLEA that has the main mandate works with these other agencies in terms of awareness and all of that, then leaving the rehabilitation for agencies like VAGDA and the department in the NDLEA to deal with rehabilitation, don't you think we will go far better? Because these agencies already have chapters across the 36 states.
We should
so
consolidate
how much?
them.
No,
We
how
should
much?
consolidate them.
The
For
reason
optimal
I'm
outcomes.
asking.
Okay.
Just a few days ago, did I say a few days? Just 2 days ago, the president talked about reducing the cost of governance. You saw ministries being merged, agencies, being saddled with more responsibilities, just in a bid, to cut cost. So how viable would this agency be to deal with this menace across the country?
I would suggest that you take the drug demand reduction department, take their vote, take the vote of its sister department in NAFDAC, its sister department in National Orientation Agency, for instance, its sister department in Nigerian Police Force. Match them, get their votes, put them together, consolidate them, and then let's have a truly civil organization that can focus on drug demand reduction, so that these other agencies can also continue with other things they are doing. I'm saying this because we are in the streets and we can see the danger that is staring us in the face. This is about
That danger,
consuming all of us.
Of course.
I don't think we should. It's just like the issue of state police. People are dying every day, and Nigerians are debating: should we create state police, or shouldn't we create state police?
Anyway, let's leave state police for its
But
own
no,
day.
what I'm saying is that some things we are talking about lives, and people we are losing our
Barrister
youth.
Akamadu, Victor made mention of the fact that some people at the moment they're on the verge of going into drug abuse. Yeah. So why don't we think about these factors?
If you talk about
I would like to hear from the consultant psychiatrist. Since you deal with these people who use drugs and you have been able to handle them or deal with the situation, the risk factors is still in this conversation. Because if you're trying to rehabilitate those already in drugs, there are those who will still get in tomorrow. So of course, that chain of people who would need rehabilitation may not likely reduce. So what are the likely risk factors really? Let's look at the young people. What are the push factors for these young people that will make them use drugs in the first place? Because if we can deal with that, at least to an extent, then nobody is thinking of getting in. So it will be those who are in, seeing that, the lives of my mates who don't use drugs are better. So why don't I stay away? I mean, some people may even get out of it on their own without any form of professional help. I don't know, this is just my own native thinking.
Yeah, absolutely.
But I like to hear your thoughts.
Yeah, so a range of risk factors are responsible for people beginning to use substances in the first place. For young people, peer influence, when you look at adolescence, the adolescence period, adolescents have a psychological developmental framework that allows them to have a close relationship with their peers. They pay, they give a great level of attention to their peers. So they are easily influenced. So if you can address some of those difficulties, empowering them, giving them the skills they need to be able to resist and to say no, that's an important part of interventions you can do. And that can be within the school settings, but also in the community settings. Other things related to opportunities for admissions, some may apply for admissions into higher institutions at the end of their secondary school education. They may not have the opportunity to attend schools. And that may be one of the reasons why they may begin to use drugs out of frustration, for example. But also there's socioeconomic determinants, constrained economic circumstances, that can really make them to begin to use substances, again, to move out of frustration, for example. But what I want to say really is we do know that we already have the Mental Health Act that's passed into law. And one of the critical components of the objectives of that act, provisions of that act, is the treatment and rehabilitation of people with mental health conditions, and ensuring their rehabilitation and integration into the society. So substance use, I reiterate, is a critical part of the mental health spectrum. So I believe ensuring, for example, we have a proposed department or a commission for mental health within, as part of this Mental Health Act. So if we can really strengthen efforts ensuring the realization of this as part of which is a critical provision in the Act, and then also incorporating other things, integration of mental health within the community settings is really important. We should also not forget that we really have a shortage, a severe shortage of mental health workforce. The clinical psychologists, the psychiatric nurses, the psychiatrists are all in very limited number in Nigeria. And we do know that we really need these services to provide the appropriate support people would need.
Okay.
So I would...
Dr. Mohammed, I'm sorry. We have to put you on hold just so that we can take this break and pay some bills. And when we return, the conversation will continue. Please stay with us. All right, thanks for staying with us. This is still Good Morning Nigeria, and we've been discussing the rehabilitation bill, which borders on drug use and abuse. But let me get to Kanu yet again, where Senator Hanga is. Now, a lot of people, those who criticize this bill, some of those who oppose it, say that we seem to want to run away from the causative factors and just deal with those that have been affected by drug use. Is the Senate considering dealing with the issues, economic issues particularly, that tend to lead people to drug use? And besides that, what is the intendment of this bill regarding collaboration with existing agencies that have a bit here and there of what it is seeking to do?
Well, the Senate is certainly concerned, like what Madam there said. The President recently talks about spending so much on so many things. But I would like to go the opinion of my Red Cap chief there, my friend, that there is need to prioritize our things. Nothing is too much for our health. Nothing is too much for our sanity. And you see, if we should cry up spending so much on things, we shouldn't have gone to spend 15 trillion on Lagos Calabar Road. We shouldn't embark on buying a new aircraft for the president. We shouldn't embark on buying a yacht for the president. These are unnecessary for now. People are dying in hunger, in poverty, in sickness, and drug is ravaging the country by the day, by the minute. So I think, like he said, this is a priority, the drug and sanity of Nigerians, because the thing has gone beyond what doctor says. That my concern is from Kano, not Kano. I'm concerned with Nigeria. I am certainly representing a senatorial district from Kano, but I'm a senator of the Federal Republic of Nigeria. My concern is Nigeria. I certainly, I just gave an example with Kano. If I had given an example with your state, you would feel bad. That is why I'm giving example with my state, because it's a fact. Go back anywhere, go around in a country, you will see the thing is terrible. If NAFDAC can do something about it, if NDLA can do something about it, they would have done it. But with this kind of organization, like my Red Cap chief rightly said, is definitely won't be where we are now. That is my take on this. That is my contribution. That is what I wanted to add.
Right. Talking about keeping the sanity of Nigerians, then, you know, you would ask if the factors pushing them to insanity keep increasing by the day, then how do you expect them to be sane? You know, but I'd like to get to Dr. Omaiza. You know, you made your observation known about this bill earlier, but, you know, away from the bill, looking at the situation we have at hand, the drug abuse issue, away from the agencies and all of that. What exactly do you think we need to do as a people? Because, well, some would say things were never better. You know, every area has its own challenges and all of that. But people just didn't see drugs as a solution. But these days, I mean, a lot of people they don't think about it. It's the only option. What changed? You know, what do you think is wrong with the society at the moment, and what can we do as a people just so that no matter the condition, whether good or bad, I mean, drug is just not an option.
Yeah, thank you. You see, the distinguished Senator Rufai mentioned that I may be a consultant for the NDLA. You know, but now that he's referring to my senior colleague here as his friend and brother, I think that I may as well tell distinguished Senator that he's his consultant. But be that as it may, you see, I posited earlier that the bill is a good one because the psychology of people that we engage is important. But the opinions I have thrown up about the bill here and there is to capture the various views that may be considered, that should be considered. There's nothing wrong with the bill. If the bill comes to state today and we have an institute, automatically I have to work with the institute because I have rehab centers in Abuja and we are planning to have others in other states. We are not only into treatment, we are into awareness programs. This year alone, we've had 2 major programs in Abuja here. We are in many communities treating youth for free. We have experts in those places, clinical psychologists in the communities, not even in the center. So these things we are doing can be scaled by institutes like he's proposing. But we also need to throw up all the arguments so that it can be properly analyzed and be sure that we are taking the right decision as a country. That being said, we need to look through the various prevention levels in answering the questions of what we need to do and what has gone wrong in our society. There's what we call the primordial level of prevention, which is where you don't even let the stressor or the problem get in contact with the people it can affect. So it means that what can Nigeria do so that there's no drug in Nigeria? There's no illicit drug in Nigeria. Maybe, I'm afraid to say that we may have passed that level. We cannot say that there will be no drug in Nigeria anymore. So we failed at that level primordial. Because Nigeria, 10 years ago, using amphetamine as an example, was just a transit country for amphetamine and a consuming country. But today, the NDLA have arrested and even uncovered many clandestine laboratories where this is being produced in Nigeria. So not only is Nigeria a using country, but also a manufacturing country of some of these hard substances. So we have drug with us. So what next? The primary prevention. So what programs, evidence-based programs that can be done to prevent people from using the drug even though they have contact with the drug? It's like saying that what do you do primarily to prevent malaria even though there's mosquito? So we say use nets, do this, use that and that. Now the same thing comes to this. We need to therefore look at programs that are family-based and community-based. There are programs targeted at pregnant women, to intending mothers, or even fathers. Mothers because, I mentioned mothers first because they are mostly closer to, with their words and are more at home. So it is important that we begin to channel advocacy programs, trainings for mothers. In 2019, my organization had a partnership with Center for Women Development, and we trained about 50 women on that. They are currently proposing same programs now to train women on early signs of drug abuse so that they can easily detect when their children are beginning to take drugs, because it's better to catch them early. I am privileged to have been caught early by my parents at the age of 11 years when I started taking drugs. So I'm not just speaking from the point of, it's from a pinpoint experience for me. So if I wasn't caught earlier, I probably wouldn't be here today discussing these matters. So parents must be able to detect early signs, which are, of course, we don't have the time to mention all those things. Then again, appropriate response. Parents should be taught on appropriate response to children when such issues emerge. A child can actually walk up to the mom and say, Mom, I have a problem with this. A friend did this to me, introduced me to this. And the next thing is that the mom can start beating the child or report him to the malam or pastor that do not know anything about drug or drug addiction. And so the next thing is, this is a taboo, and then stigmatize the child and even cane the child or do whatever. But not knowing that that may not be the only thing that the child needs. I said that because there is a role for spirituality in the treatment of drug addiction and even mental illnesses. Now, there are also programs that can be done for parents to understand coping strategies of children. Senator has mentioned that, the kind of rehab we want to have, when we have that kind of rehab, people will come in and go out and not even do it again. You can't say that. In the best of climb, relapse is part of recovery. And we have also said that people relapsing after treatment is not treatment failure. In fact, the 6 stages of change, starting from pre-contemplatory stage up to maintenance stage, the 5th stage, the last stage is relapse. So it's possible. So, and that is why if you really understand what addiction is, perhaps, I don't know who are in the team of the senator, to put some thoughts into what addiction is and help us understand that, see, addiction is not something you say that is one thing you do and it will be solved. So you have to give an open mind to whatever you're proposing to solve this menace. It affects all of us. It affects all of us. So that being said, so there are programs for families. Now there are programs for children. Barrister Kamado have mentioned how he has been to many schools doing programs and all. All of those things are primary prevention for those who are intending to use. When I speak to an audience, I tell them there are always 3 types of audience when you are talking to people in this context. The first audience is people who have not used but are about to use. They are not planning to use, but they are about to use. Because tomorrow, a friend will come to them and say, taste this. This dose will not affect you. If you take it small, you'll be okay. They are going to meet this in the future. So that's the first group audience. The next one is people who are about to use. They are planning. They have been exposed to it. They are only looking for an opportunity to use it. They have already made up their mind they are going to use it. They have seen somebody using it and they want to use it, but they've not had opportunity to use. The third set are those who are already using. So that means when you target programs that aim at these people who will use and those who are about to use, you are able to prevent the few who are already hooked on a substance and need treatment. So at primary prevention level, that can be taken care of. Then the next level, secondary prevention, this person is already using the drug. What do we do? So it's not just taking him to the rehab. There are people who come for outpatients alone, have sessions weekly for some months, and they are good to go. But there are those who will need to be admitted for institution therapy programs. So the kind of rehab the senator is talking about is an interesting one. But there's even more to that. There's something we'll call treatment community, where it will be like an estate, and all the people in that community have used drug before. And so there are industries in that place where they can work, they can have their families in that place, they have accommodation, they can live their normal life in that place because they have had contact with drug. Because addiction, we say that recovery is a lifetime journey from addiction. Because somebody can be sober for 5 years and relapse. Somebody can be sober for 10 years and still relapse. So it's a lifetime journey. It's not the 6 months, the 3 months, the 1 year you do in a rehab that is all about recovery. It's a lifetime journey. So at what point do you say somebody is fully recovered? There's no point. As far as you have ever used a drug. That is it. So moving again to the next one, tertiary prevention, where you manage complications that would have arise from this person's behavior. People are coming into the facility sometimes with legal cases. Some have been rusticated from school, expelled from schools, complications. Some already have kidney failures. I have lost patients due to kidney failures. after undergoing several dialysis, and they couldn't survive it because of drugs. So how do you manage these disabilities? And there are people too who they have lost hope. We call it learned hopelessness. Somebody have tried and made efforts, been to several rehabs in South Africa, in Nigeria, here and there, and you just feel, you know what, I can't help myself. That's a complication in itself. So this is where you need services of the multi-specialty, to assist the person. So you are not even just talking about psychologists. You need spiritualists, pastors, imams. In fact, there is a program in treatment that is called the 12 Steps, which is a spiritual-based program, where you believe that this addiction is more than you. You need a superpower to assist you, where you recourse, of course, to your religion and your beliefs.
Thank you very much, Dr. Meza, for your contributions. Let me get back to Dr. Mohammed. Now, let's assume the bill has killed second reading, and if it kills, the third, and the law comes into effect, how might we make the most of the new agency, considering that there are causative factors? There are those who are far gone into drug use, needing rehabilitation, and then there are others in the chain. How do we make the most of such an agency?
Yeah, so as I said earlier, the treatment of addiction is actually multidisciplinary and certainly multi-sectoral. So there's really a need for close collaboration with a lot of agencies and sectors. I mentioned the Mental Health Act, which a critical part of that is the provision of mental health services and rehabilitation support, to help people recover from mental illness and substance use. So ensuring that the interventions we do, we provide are evidence-based, are based on scientific evidence, and integrated into the community settings, the school systems, and so on, can really help to cover, as Dr. Omeza said, ensuring that we look at the different facets of prevention, promotion, treatment, and rehabilitation in different sectors. So I think multi-sectoral collaboration.
Dr. Mohammed, earlier you talked about personnel, trained personnel in this field. If this institute comes on board, do you think it will face a problem of staffing?
Yeah, absolutely. That's why I mentioned about the Mental Health Act. We do know that we have a severe shortage of mental health professionals in Nigeria. For psychiatrists, for example, we have one psychiatrist per 1 million population. And this is even worse for other multidisciplinary mental health team members, like the clinical psychologists, occupational therapists, and other workers.
Okay, thank you very much.
So that's really important to consider that and to see whether we should strengthen the provisions of the Mental Health Act, have a department, a commission for mental health, and ensure that we provide high quality care integrated into primary care. But also having support for people that may have need rehabilitation.
All right, thank you. Thank you so much, Dr. Mohammed. Let's get to Senator Rufai as we begin to round off this conversation in a minute, actually, Senator Rufai. You've heard the submissions of our guests right here in the studio. I just want to hear your final thoughts about this bill.
I'm very happy to attend this program, because at least I'm opportune to meet the doctor who has some rehabilitation centers around that I didn't know. I'll be glad to visit one or two of them, and then maybe we can be partners in trying to help our people through his organizations. I'll be glad to meet you, doctor, since you have these facilities around here and there. It is very important, but I want to emphasize that there is nothing, no amount of money spent on us as citizens is too much. No amount of money spent on us, on our sanity, our cycle, and our everything is too much. If we can spend on other trivial things, like I mentioned, I don't want to mention again, it's too much.
Did I say doctor? Senator Rufai, now that you want to visit Vagada Specialist Rehabilitation Center, does that mean you're dropping the bill?
Sorry? I'm not
collaborate. Now that you want to collaborate with Dr. Hope Omaiza, who is a specialist in rehabilitation centers, does that mean you're dropping the bill now that you know that there are other rehabilitation centers that are functional?
You do the convincing for me during the public hearing for people to accept it, because I meant well. I mean well for this for this bill, and I'm happy. I'm vindicated by most of what people said there, especially the two doctors.
All right. Thank you so much.
I think we have a moment to allow Chuks Akamadu also give his closing remarks.
Unfortunately, he's lost his consultancy job with the senator because
My last word would be that what should concern us is this proposed institute. Is it going to justify every kobo that is going to be invested in it? Nigerians should ensure that the institute justifies its establishment. There should be, we must place
Value for money.
yes, we must place a demand on the institute.
thank you very much. Chuks Akamadu, President Center for Ethical Rebirth among Nigerian youths, Serene, barrister at law. Many thanks.
Thank you so
once
very
again
much
for joining
for
us.
having
We
me.
appreciate you for your insight. Dr. Hope Omaiza, MD, Vagada Specialist Rehabilitation Center. Thank you so much for being our guest again today. Always a pleasure to have you. Dr. Muftar Mohammed, consultant psychiatrist and senior lecturer at the University of Abuja Teaching Hospital, and also the founder, CEO, Safe Brain Organization, a non-profit charity dedicated to support of those with mental health and well-being of children and young people. Thank you so much for being our guest.
Thank you for
And
having
of
me.
course, Senator Rufai Hanga, thank you so much. Deputy Senate Minority Whip and Senator representing Kano Central. It was a pleasure to have you on the program. Thank you so much for being our guest. All right. All right, so that's it on Good Morning Nigeria today. Pay attention to your sanity, just so that you're not pushed to insanity. I'm Yenri John. Have a great weekend.
And I'm Victor, as we will see you again on Monday.